Hi, Harold.
Hi, how are you?
Good. How are you?
Very well. Let me just see if I can position this. Pardon the my elegant setup here.
Mhm.
There. So I don't know if we've ever met before.
I don't think we have.
I'm
But thank
Harold
you.
Pollack, and nice to meet you. It's great to meet you in the context of JHPPL and this great paper.
Oh, thank you.
And um, so, so why don't we start by you can describe a little bit about yourself and your team, and then we can get into the paper itself.
Yeah, so I am a political scientist at Stanford who mostly studies money and politics and political preferences and ideology. So Howard Rosenthal is a political scientist at NYU. He has a similar research sort of background. And David and Christy are both were at the time when we started from Columbia,
Mm-hmm.
uh, working with the team on researching sort of physicians and the politics of physicians. David and Howard have actually known each other for quite a long time, and sort of overlap. They sort of had overlapping interests in this area. So Howard did some of the really formative and early work on measuring ideology in
Mm-hmm.
American political context, and David has long been focused on sort of the politics of physicians and activism among physicians.
Mm-hmm.
And physicians as a profession, and Christy works alongside David.
And so, and particularly, I think fairly senior authorial team. David J. Rothman would be pretty well known to JHPPL readers, of course.
Mm-hmm.
Howard Rosenthal, for the people who study political polarization, is
Yes.
Familiar folks as well. And so, now, what made you think about doctors in this context?
So we had an earlier paper where we were looking at sort of the breakdown of political preferences of physicians, and this was published in JAMA IM, I think back in 2014. And really that was sort of a descriptive dive into the data. So I had all this data on the political contributions of physicians, and we were able to match that up with the NPI provider database, which gave us more detailed information about specialties, medical schools, and some demographics, which allowed us to really sort of dive into it. And one of the things that really stood out and was very interesting early on, was just how divided the profession is and polarized the profession is along primarily along sort of lines of specialty. So there seems to be a great deal of sorting into what specialty physicians are selecting into, also along age and gender. And so once we saw those patterns sort of laid out, we became much more interested in sort of some of the ramifications. And one of those is sort of choices about workplace and choices about where to live.
By the way, I should say this is a big data analysis. There's a thing here where you identified 1,027,708 unique physicians.
Mm-hmm.
And is NPI National Physician Index? Is that the?
Yeah. Yeah.
So I mean, this is one of the
provider index. Yeah.
The provider index. One of the striking things about these data is it's so large that you can control for things like, what medical school people went to. I mean, there's all sorts of things that you can do because you have just a monster data set.
Mm-hmm.
Just on the political preferences of physicians, what are some conservative specialties and what are some more liberal specialties just within the field?
Yeah, so in broad strokes, surgeons and surgeons tend to be the most conservative of the specialties. And on the sort of more liberal side, you have pediatricians, and also mental health professionals. They sort of anchor the sort of left side of the political spectrum in terms of the in terms of specialties. And in the middle, you sort of have a wide range of specialties like dermatologists, ophthalmologists. And it does appear to look it does appear to track average earnings within the specialty pretty well, which is also sort of an interesting finding that we uncovered early on.
The and also, as you mentioned, age and gender
Mm-hmm.
be a factor. Yeah, I remember in the debates over the Affordable Care Act, it was really striking how family physicians, pediatricians, mental health professionals tended to be very strong advocates for the ACA, and some of the other specialties that you mentioned, people tended to be much more skeptical.
Yes.
And there's a lot of, and if you look at who is in Congress, who's trained as a physician, very often they're surgeons, and they do tend to be on the conservative side.
Yeah, strikingly, when we looked at which physicians within Congress, they were overwhelmingly conservative at the time we were conducting the study, which is not actually representative of the profession at large, which is much more polarized and divided. But that's exactly right. You see a higher number of surgeons and sort of higher paid specialties running for office.
Yeah, and of course, since resources are helpful to run for office,
Yes, they are.
there's still logic to that. Now let's get to your current paper here. So you looked at physician mobility. Can you sort of lay out, at least maybe we'll start with a 50,000-foot view. What's the guiding question in this paper?
So the guiding question is, so I'd say twofold. So on the one hand, there's a political question of sort of more interest to political science, of this question of partisan or ideological sorting, whether people are choosing where to live or where to work based off of their partisan preferences, that they're taking that into account and making these decisions. And one of the reasons why that question is attractive in this context is there's a very special relationship or process that happens within among physicians, where they have to move and conform to the match requirements. So many of them have to move to places that they never would early on in their careers, because that's where there's demand for physicians, and because of the match has to conform to the geographic specifications. And then you have this question of where do they move after? So if you're a very liberal physician and for whatever reason you had to move to a really conservative area, you're more likely to move back. And so it created sort of a quasi type experiment that we got to look at from an observational standpoint. And so that's the sort of political science side where we thought looking at physicians was very interesting. Also, they have the resources to live anywhere they want. It's not one of the main things that the political scientists have found that had restricted most of the population from sorting along partisan lines is just a huge resource question. Most people can't afford to live everywhere they want to, and that's much less true among physicians. But there's also a very policy relevant dimension to this, which I think speaks more to the questions about healthcare provision. And that is that it's very, very difficult to get physicians to work and live in rural areas where they're needed the most. And part of the angle that we're looking at this is we knew beforehand that the physicians were trending very, very quickly to the left among younger cohorts. So people who are entering the profession now are far more likely to be Democrats, far more likely to be liberal than previous generations. But also we're seeing an increasing shortage of physicians in these rural areas that tend to be more conservative. And so bringing those two sort of ideas together, if physicians are sorting along these political dimensions, it means it's going to be harder and harder to get physicians to the places where they're most needed. And that's sort of a very big problem for healthcare provision, especially for things like the ACA, which has really struggled with getting physicians into rural areas.
Yeah, it's interesting. Political polarization is really emerging as a very challenging area for public health, and for many different reasons. But one that, I mean, I think many JHPPL readers are probably thinking, well, it's a problem because we're trying to get certain policies passed that, there may be political polarizations and optional policies. But healthcare provision and public health messaging to people who are in more politically and culturally conservative areas and populations is emerging as a real problem. And mean, the cultural conflict over wearing masks is kind of to amping it up to 11. But this is a problem that exists that your paper really leads us to think, well, if I need mental health care and I live in rural Ohio, and politically liberal mental health professionals are just not real interested in moving to rural Ohio, how am I going to have more trouble just getting a healthcare provider because of that?
Yeah,
Should I be concerned?
the answer seems to be yes. Especially in mental health care providers, that's probably the area that we see the greatest shortages in these rural conservative areas. There was, I can't remember the exact number, but there's a news article, and I think it was in the Times or the Post a few months back, looking at the sole mental health provider in this gigantic county within Texas. And so you do see that, and and this is probably going to get worse before it gets better, unless there are some policy, some very strong policy solutions that are passed to make it so that that the distribution is more evenly felt across the population.
So, I mean, how can we respond in policy? I can see that you could say there's a bump in rural salaries, but it seems like if people don't want to live in rural areas because they don't like the political values of those communities, it's kind of hard to deal with that through policy if you're trying to attract young doctors.
Yeah, and so it's just like we're not able to fully determine whether it's just people are trying to sort along political lines, or whether there's some other sort of lifestyle choices that are driving a lot of these decisions about where people want to live that are highly correlated with ideology. But in this case, it's a very hard problem. So it's not just the United States where we see these shortages of physicians in rural areas. But I'm not aware of other countries where the political dimension is so salient in this case. And one solution that was talked about more and more is sort of remote provision of healthcare services, which may be part of the solution. So just we're living through a grand experiment in sort of the mental health community where there's a lot of remote provision of these services. So maybe that is a bright spot that we could point to as a way of moving forward. But fortunately, in our paper, we don't get too deep into what potential policy solutions could be to this problem. We're just more identifying.
I think some of the same issues arise in public health and social work as well. I teach in a school of social work, and one issue is also the political preferences of the social work community are certainly quite far to the left of the median voter in rural Ohio. And our cultural competence as a profession in serving those communities isn't so fabulous because that cultural political perspective isn't particularly present in our classrooms. Mm-hmm. And one thing I've actually thought about is we need to have affirmative action programs that are targeted towards more rural conservative people in a cultural sense, because this is an underserved population. I don't know if that's something that you've thought about.
No, but I mean, you bring up an important point that part of this is probably a pipeline issue where, it's so politics seems to be really salient at this moment, and so selecting on political preferences is probably a hard thing for schools to do, a big step to take. But thinking more about trying to recruit people into these professions that at least come from these communities is probably a good step in the right direction in the long run. But there is a more general trend that we're just seeing, not just among physicians, but the population at large, but especially among professionals. So the professional class, of which social workers and healthcare providers are members of, that has just trended very far to the left in recent decades. And and that's not slowing down from what we can see in the data, that every cohort that enters the profession every year who is graduating seems to be more liberal than the previous cohort. And so there's not really a sort of we haven't hit the point where the profession is actually looking more like the population. In fact, it does seem to be diverging more and more each year.
By the way, I neglected to just identify the blocking and tackling of the paper. How do you know the political orientation of the people in your sample, of the roughly 250,000 people that you have good data on about that? Can you say a little bit about how you did that?
Yeah, so our primary approach here was to look at campaign finance data. So individual contributions, which are all part of the Federal Election Commission's database and disclosure database, which lets you, and by looking at who physicians gave to, whether they gave to Republicans or Democrats, gives you a good idea of their political preferences. And so from there, we were able to capture a sizable percentage of the population, which, given the enormity of the data set, gave us a lot of granularity in the way we could look at it. And we're also able to sort of compare these measures to what you see in public voter files, which Eitan Hirsch, who is also published in this journal, has shown. And so we're looking primarily at these contribution data, but we also are able to sort of compare that to what we see in the party registration data, which gives us very, very similar layouts of the profession.
So, yeah, so I think that your ability to merge that data is quite interesting.
Mm-hmm.
Let's say it's a little, I'm sure many people who contribute to political parties are thinking, whoa, I never really thought about all the different ways people could integrate that data. Now, how about people sorting within their workplaces?
Yeah, that was one of the more fascinating things that we didn't know ever as good of an idea going in that we would see this. But because within the MPI directory, we have basically a panel which allows us to track where people have chosen to work going back to 2008. And so basically we can see when people are changing workplaces. So even if someone's staying in the same area, and so there's lots of reasons that someone may stay in an area where their politics don't match, family reasons, a whole variety of reasons. But even in those cases, when we could sort of look down and say, okay, people moving within the same geographic region, we're able to sort of track whether people are moving from workplaces that don't match their politics to ones that do. And we see that pattern very present in the data, which was really quite striking. It's just as strong as basically the effect is just as strong as what we see geographically, that not only are physicians choosing where to live based in a way that's very highly correlated with their politics, they also seem to be sorting into actual workplaces. They'll go from one practice to another if their politics better fits that other practice. And just seeing that, it's actually, those are two of the best predictors of whether someone's going to change their workplace or where they're living, which we found really quite surprising. We expected there to be an effect, but not one that was as large and as clear as the one that we observed.
So polarization is really, it's in our everyday work life and where we live and with whom we work. And it is sort of striking. There's a lot of surveys about what would you think about who your child marries, and there's more of a sense now than 25 years ago that I don't want my child to marry someone who has a different political perspective.
Yeah, and just so anecdotally, I have a friend who's a physician who he was a hospitalist, and he'd go and live in where he'd sort of go in to rural areas to set up hospitalist programs. But I was asking him how he had chosen his specialty, and this was actually before we started this project. And he said, I was thinking of becoming a surgeon, and I went into the lounge for the surgeons, and Fox News was on, and then I went into the other lounge, and there was MSNBC, and that factored into his decision, which it's very sort of interesting when you talk to physicians. A lot of times that they're very willing and readily sort of confirm some of these patterns that they are actually incorporating these factors into their decision making to some extent.
It does seem like when we think about the sociological role of physicians, this troubles me because physicians are sort of authority figures who in many ways cross traditional divides in the society.
Mm-hmm.
People trust their doctor in a way that they do not trust the MSNBC or gone are the days of Walter Cronkite, but it's also gone are the days where I'll just go and ask my doctor about this sensitive issue, if without that also being a process that has now been politically sorted.
Yeah, and obviously it seems to have gotten much worse in the last few months, and it is. I'm aware of surveys where physicians are pretty consistently near the top of the most trusted professions, our paper doesn't really speak to this directly, but this question of this broader sort of polarization within the profession may take a toll on that, and we have we're not at a point yet where we really can observe that yet, but that is one of the major concerns that are looming.
Are there other professions, by the way, where you might be able to do a similar analysis?
Yeah, so I have another project looking at lawyers who are very politically active, even more so than physicians, where we don't see as stark as divisions within the legal profession. But you do see this sort of growing polarization. You see the same general trend of sort of younger lawyers being much more democratic and much more liberal than older lawyers, older cohorts. And so that's sort of a more general pattern that seems to be replicated among these two professions.
Is it possible? I wonder what nurses would look like if one did something.
So we do have some data on nurses as well, because they're included in the NPI, and we didn't include them in any of the studies, but they tend to be much more liberal on the liberal end of the spectrum. They look generally more like pediatricians.
And of course, because nurses are predominantly women,
Mm-hmm.
And there's a big gender split.
Yes. Mm-hmm.
In that way. What a fascinating research program. It does. I must say, it's a very concerning paper in its way. It is. So what's next for you in your research agenda? You've got the lawyers. You're going to analyze lawyers. What else is on your agenda?
So I'm actually sort of so I just finished up a book with Maya Sen over at Harvard on sort of the politics of lawyers and sort of their importance in the political American politics more generally. And so I'm actually sort of in a transition period, just having wrapped up the book, and so I haven't quite settled on sort of my next broad research agenda.
On the book, what's the book's title?
It's called The Judicial Tug of War.
And is it available for pre-order?
Not yet. We just turned in the proofs for it, so it's in the production stage. But
well, when the time comes, you'll have to tell me. I'll have to put it on my Twitter feed.
Okay. That'd be great. Thank you.
It is sort of this intersection of partisan politics and the professional world that we live in.
Mm-hmm.
And I must say, it is striking to me. I do a lot of criminal justice research, and the world of my academic colleagues is almost 100%. I mean, I'm the most conservative person, I think, at my school because I'm a liberal Democrat. But much of my world is people who voted for President Trump and who have just very different orientation. And the need to be able to code switch in those different worlds and to see what is, to be able to move within those worlds in a way that sees what's a value in them, it also sees what the blind spots are within them, seems to be really important in this moment. But there's very little happening in the environment that gives us the tools to do that well. At least that's been my experience. My I worry quite a bit that my students are not particularly well equipped to go into the world of rural America or conservative America, uh, and also that they're very angry and don't want to be in that world. Uh, for reasons that I understand personally, but that raise issues about who is, who is going to provide services in these areas, and how do we address that? Now, why aren't there more medical schools? And I mean, one of the points that you made in your paper that kind of went by quickly is the location of medical schools is also very much in liberal areas to begin with. Yeah. Can you say something about what's going on with that and whether that can be addressed?
So I believe that has, there's a bit of path dependency on where these medical schools, and part of it is where major universities were located, but it's also sort of more codified in, I believe, the 1992 law that sort of set funding from Medicare, I believe, based off of where these training programs were. And that distribution was skewed more heavily in what are now very liberal areas. Things
the balanced budget act kind of froze in place some of those funding allocations. Yeah. that kind of made that a little hard to change. So yeah. I wonder if one of the policy changes we might do is just think about where we have medical residents being trained, and maybe we need more in parts of the country that are less liberal and that are less highly served. Yeah, and I think we're seeing a little bit of that happening at the moment, where there's at least a movement to get more medical schools and teaching programs set up in more rural states, because there's, Boston has enough of them. Yes. And it probably does help quite a bit. So, again, for the pipeline issue, some people don't necessarily want to leave their state to go to school, or, they have reasons why they can't go out of state for 7 years to do their training. So it's, having that possibility in these areas is probably very important, and probably is, in some ways, that even if you didn't factor in sort of the political preferences angles to this, it's probably really important in the sense of just getting people from their own communities, being able to train where they're going to work, probably would have a significant effect. There are also, incentives for physicians to go to rural areas and live there. You make a lot more money as a general practitioner in rural Arkansas than you do in New York City. Hey, you mentioned that. That sort of surprised me. And of course, it's a lot cheaper to live in rural Arkansas than in city, I'm told. And there's, presumably, part of why you make more money is because there's fewer of you. Mm-hmm. Yeah, supply and demand in the labor market there. And in New York and Washington, D.C., there's some of the lowest paid physicians, which defies some of your expectations about how the economics of this labor market should work. And so there's clearly a distributional, something distributional going on that is trumping what would otherwise be driven by these labor market economics. And we just don't see that really proliferating. Just the notion that you could live in a gigantic mansion in a lot of these rural areas versus living in barely scraping by in some of these really expensive areas that have way more doctors than they probably need. Absolutely. Yeah, certainly. If you look at concentration of mental health professionals, my understanding was that every other house in Ann Arbor was a mental health professional. I mean, it was just very, there was no shortage. By the way, I should note that there are also many rural areas that are not particularly conservative. That are also underserved. Certainly places that Native American areas, various places where race, ethnic minorities in rural areas have very significant access issues. But also, I don't want to leave the impression that rural Ohio is identified with a white conservative area, because it could also be other folk living there with other political values. Yeah. Now, what haven't I asked you that I should have asked you, or what is it that people ask you that I haven't, that I should let you correct me on? So I think you got all the big questions about sort of what's happening here. The sort of, and I got in the point about sort of the match program driving like the initial geographic distribution.
I guess one other thing is like there is this sort of crucial period where physicians are making their choice where to live, and so we have that figure in the paper where people who are about 5 to 10 years out of their medical school, that's when they're moving and they're deciding, and so you have this window, and then the amount of mobility, the mobility levels among older physicians drops pretty dramatically after that period, and so a lot of the action is happening all at once in terms of an age distribution. And so, and once people sort of settle down, have kids, they're much less likely to be mobile. And so, a lot of this problem is going to need to focus on that early stage in physicians' careers, if there in terms of sort of potentially tackling this problem.
And given both the age effect and the period effect, younger people are skewing more liberal, especially now, if the time that people really move is relatively 5 or 10 years after you're out, that's relatively young. That is leading liberal people to leave, to not go to or to leave from more conservative areas and settings. That's the more common migration pattern. Is that a fair statement?
Yes. Yeah.
Well, it's well, they say a liberal is a person who can't take his own side in an argument, and I'm sort of, as a liberal person, feeling this is I'm really concerned about our patients and people in need in more conservative areas reading your paper. And one thing I'm not concerned about is the quality of the paper. This is a really interesting analysis, and congratulations.
Oh, thank you.
And thank you for taking the time to talk to me about it.